% of Americans have some form of periodontal or gum disease. If fear of pain is keeping you from the dentist, you're going to want to see this new medical breakthrough. Christy Kruger tells us about some simple trays that you can use at home to get rid of gum disease and decay and keep it away for good.
I've had periodontal disease my entire adult life.
Joan Katz takes care of her teeth, yet she still has periodontal disease, also known as gum disease. She has a strong family history for it. Gum disease is caused by bacteria and food debris that creates a biofilm that builds up all around the teeth.
That biofilm, left unchecked or not cleaned by the patient, tends to progress, and the infection gets into the underlying gum tissue and eventually the bone, and erodes the bone and the gum tissue.
Warning signs include bleeding or swollen gums, persistent bad breath or taste, and loose teeth. For Katz, surgeries kept the gum disease away temporarily, but it came back again and again.
I've had 2 surgeries for it, which were extremely painful and difficult for me. And when Dr. Pohl said I needed a 3rd time, I said no.
That's when Boca Raton dentist Mitchell Pohl told Katz about Perio Protect method. Using custom-formed trays approved by the Food and Drug Administration, antibacterial medication is directed right to the source of the infection.
In my office, we use a peroxyl gel, which releases hydrogen peroxide, and we use a tetracycline solution.
And you put in your medication, and you put it in your mouth and you leave it in for 15 minutes.
The seals in the tray hold the medication in the pockets right between the teeth, long enough to kill the bacteria and control the infection. A patient with gum disease like this could wear the trays anywhere from 5 minutes a day to as long as 15 minutes 6 times a day. How long they're worn depends on the severity of your gum disease. This patient's teeth changed dramatically just by using the trays faithfully.
Using these Perio trays, it really takes away, especially the fear and of the pain, because cleaning appointments are much easier.
As for Katz, she no longer has to go through the pain or the expense of surgery.
It pays to keep your teeth, and this is a good way to do it.
The cost of these trays depends a lot on just how severe your gum disease really is. But right now, a number of national dental organizations are working with insurance companies, trying to persuade them to cover the expense. With your Good Health Report, I'm Christy Kruger. And to prevent periodontal disease to begin with, Dr. Pohl suggests brushing and flossing your teeth regularly, avoiding foods that are high in carbohydrates that stick to your teeth. And also, children should especially avoid drinks with acid and sugar, like soda, some juices, and those sports drinks.